Hello everybody, I am Dr. Annapurna. Welcome to the Homeopathic Studio. Today I would like to discuss a case of intellectual disability which has been treated effectively with homeopathic medications. Let us first understand what is intellectual disability. Intellectual disability is a state which is characterized by below normal levels of intelligence, that is lower IQ levels, and there is a lack of skills for learning the day-to-day activities. It is generally characterized by delayed milestones. The child shows a delay in developing the milestones. There is a delay in speech development, and it takes a lot of time for the child to master the skills like potty training or dressing himself or feeding himself. The child can learn new things, but it takes a lot of time and effort to learn new things. And this condition can usually be diagnosed during the infancy or during the school going age. And generally these children can learn but need a lot of assistance from parents and the caregivers. This condition is generally, it could be mild or moderate or severe or profound depending on the IQ level of the child. And generally for diagnosis we need to do the clinical evaluation along with the IQ level assessment of the child. Coming to the case, this is the case of a 9-year-old male child who was brought to the clinic with complaints of poor memory, and even slightest of the instructions he was not able to understand, and forgetfulness even for the simplest things, and speech was very unclear. He was not able to speak more than 2-letter words, and very few number of words he was able to speak. And my observation was, as the child entered, he appeared to be very dull. He sat in the chair with a vacant look. He was just staring outside the window. And when I tried to connect to him or call him, he was not responding. He was in his own world. And he was not also responding to any other surrounding stimuli. He was just looking outside the window. So he was diagnosed as intellectual deficit with speech issues. All his developmental milestones were delayed. And coming to his symptoms, so this child, he was born in an environment where it was a joint family, and the environment in the home was very stressful. The mental and behavioral aspect of the child, he was mild and submissive child, but whenever he was forced to do something, he would behave stubbornly and get angry. And he has poor socialization, he has fear of strangers and for meeting new people. In the past history, so there is a history of recurrent colds and coughs. There was history of recurrent and chronic tonsillitis, and tonsillectomy was done when the child was around 6-7 years old. In the family history, the mother is a known case of hypothyroidism and obesity. Personal history of the child, he likes to have cold drinks, cold foods, he has a craving for sweets, and thermally he is a hot patient. So considering the evolution of the case, if we do the miasmatic diagnosis, the fundamental miasm in the case is psychotic and the dominant miasm is tubercular. And coming to the symptoms, so there is delayed milestones, the memory is poor, understanding is poor, yielding passive mild child, there is fear of strangers, craving for sweets, craving for ice food, cold drinks, he is a hot patient thermally, and history of chronic tonsillitis with recurrent URTIs. So we can see the clear evolution of the Baraita group in this case, but in this case there is a strong affinity for glandular affections and strong tubercular involvement is there. As we see, there is recurrent URTIs in the past. So because of the hot thermal patient and glandular affinity and strong tubercular involvement, Baraita iode was chosen in this case. And let us come to the follow-ups in this case. So before homeopathic treatment, the speech which was incoherent and where the child would speak not more than few two-letter words. So after 1.5 years of homeopathic treatment, the speech has become spontaneous and he is able to frame sentences and express himself spontaneously. The socialization which was poor, it has improved. Now the child mingles with family and plays with friends. The cognition and comprehension which were very poor before, now they have improved and the child is able to follow instructions and he is also able to do simple money transactions. Memory, which was very poor before, now he is able to memorize and recognize alphabets, numbers, and he is also going to school. And if we come to the assessment values, the chronological age before treatment was 9, now it is 10.7. So the developmental age at that time was 6.8. It has increased now to 9.4 years. And the social age, which was 6.7 years at that time, now it is 7.8 years. And the developmental quotient, which was 75, it has now come to 88. And the social quotient, which was 74, it has now come to 93. So this is how homeopathic medications help in improving the IQ levels of child and speech issues also. They also help to overcome the speech issues, help in improving the memory and understanding of the child with intellectual disabilities. Thank you.